As we learn more about the coronavirus and how it spreads, guidelines can change, and they have. Our Cash Matlock speaks with area healthcare workers about how they're keeping up with those changes. He joins us live in the studio. Cash.
Joey, doctors tell me that they get updates with new procedures almost daily. Sometimes it can be challenging to keep the public informed with the most up-to-date information, and they're urging people to be careful with what they read online. Dr. Dustin Gentry is a physician at Winston Medical Center. Recently, he's posted updates on Facebook to help provide the public with the most accurate COVID-19 related information as possible.
There's no order that I know of that makes it illegal to be in public without one, but it's common courtesy right now in the times that we're living to make sure you're wearing a covering over your nose and mouth.
It's no secret there's a shortage in personal protective equipment. Some people spend time online arguing about whether or not surgical masks should be worn by everyday citizens or donated to healthcare workers and first responders. Gentry says for the average person, the face covering doesn't necessarily need to be medical grade.
It can be a handkerchief, a shirt. You know, I've even seen people do creative things with socks.
He says it's important to know that face coverings don't really protect the person wearing them.
It is to protect other people in case you have coronavirus and don't realize it.
According to Gentry, it's also important to know the difference in each mask.
Disposable surgical masks, like this one, are meant for healthcare providers who are in contact with patients. Then there are the homemade masks like this. That can be, and the one that's around my neck, that can be worn by healthcare providers, first-line workers. And then this is an N95 mask, and I see a lot of patients wearing them, and that's fine. But these are in short supply right now, and they need to be reserved for healthcare workers that are doing risky procedures like intubating people and doing things in the hospital setting.
Researchers are learning new information about the virus every day, and local doctors and nurses are working to keep everyone informed. And instead of getting your information from social media, Gentry says it's best to ask your local healthcare provider.
I think people should listen to their to the primary care provider that they have and follow, that they trust, that they've got rapport with, and just do what they're asked to do. And remember to wash your hands and hard surfaces often throughout the day, and just stay away from crowds right now.
For the latest information from the CDC regarding face masks, you can visit our website at WCBI.com.